check in with the Guam Memorial Hospital Administrator Lillian Posadas. It's been a while, Lillian. Half a day, good morning.
Half a day, good morning. Can you hear me okay?
Yes, we can hear you. You look great.
Well, thank you. Everybody looks great too. It's the season, best part of the year, right?
Yeah. I want to ask, did you get vaccinated? I don't know if we spoke since.
Yes, I did. Was on the first day that we got our vaccine supply from Public Health, December 17th. But I couldn't get it during the earlier times because I was in just so many Zoom meetings. I got it at 4:30. Mm-hmm. Yeah, and I really did not have much of any reaction to it other than the sore in my arm and a little bit of fatigue the next day. I felt kind of lung up. Just wanted to sleep. But other than that, no, I feel great. And I feel really, really relieved and just great that, we have this weapon to help us fight this COVID pandemic. And so hopefully we can get as many people vaccinated, here in the hospital, the staff, and also the community. Mm-hmm. So yes, we have about 800 of our staff who got vaccinated. Wow. So that's like about 72%.
Right, kind of like what you were saying when you did the survey early on. So that's good.
Right. Yes. We'd like to increase it to at least 90% of our staff to get vaccinated. But of course, we respect their concern and their hesitancy. So, but the confidence level is there. Most of us, all of us who got vaccinated, very minor reaction to it.
Mm-hmm. So,
Lillian, when you had those people decline the vaccine, was there a reason given, or do you have that information? Just curious, is it just a fear of needles, or do they have other concerns?
It's other concerns. Those with multiple health conditions, those who have had diagnosis with cancer and are going through, some chemotherapy, some treatment, and they're concerned that their immune system is kind of compromised. And so understandably, but again, the science that we've gotten from the folks, the Moderna and the Pfizer, those really should not, other than those individuals who are immunocompromised or on medication that compromises their immune system, and those with history of severe allergic reaction, those are the ones who are really exercising caution and not really recommending that they get it. But for most part, it's very safe. Even if you have multiple health conditions like I do, it's very safe. So I'm confident with it.
Okay,
good. And there's a lot of confidence out there. And I mentioned, we were talking to Dr. Wen earlier, and I asked, I'm just curious about, we have the vaccine now, preventative, just to prevent the spread, but you are handling a lot of treatment. So you've been keeping up on the news as far as any developments go, as far as treatment is concerned?
Other than this, the monoclonal antibody therapeutics that we have initiated here, the bamlanivimab, we've given those therapeutics already to individuals who meet the criteria. We have the Regeneron, which is also a monoclonal antibody therapeutics. We received the shipment, and so the doctors have already pretty much gone through the protocols and have approved it. We've also administered the convalescent plasma transfusion. We've given that. And then with the vaccines, those are the pharmaceutical therapeutics that are part of the treatment for COVID. Other treatments such as the remdesivir, we started that when we first received it. With the Decadron, that's the steroid. We've also instituted a very robust proning program. When the individuals are here in the hospital, we try and get them proned every 2 hours so that we prevent them from getting to the point where they need to be on a ventilator support. So those are some of the treatment modalities that we have also instituted here in the hospital.
Mm-hmm.
So you have weapons in the arsenal. You're not just going in there unarmed.
No way. We have PPE, the protective gear and equipment, training. We've done a lot of training. And so, with all the experience, I think our staff are feeling really confident now and not as fearful when we first started. The anxiety level has kind of come down. So, yes.
Yeah, kind of a trial by fire, all the medical degrees you have there in the hospital. And when this thing arose, at first it was like, well, there's nothing we can do. But now you're learning, you're seeing the studies. So just, give people a little bit more confidence in the fight against this.
Yeah, and there's been, many successes. The many people that have come here have recovered and have gone home. Unfortunately, there were those who, lost the battle. And, again, our condolences and our prayers to the families for those individuals who we lost along the battle. But, for the most part, many have recovered and have gone home.
Yeah, and I think as we head into 2021, there's just a sense of hope out there, with the vaccine, with all these treatments, with the knowledge that we're armed with now. There's a lot of hope for the people.
Right, there is a lot of hope.
And we talked before the vaccine came out, all these projections of, the effectiveness and, reactions and whatnot. Are the numbers we're looking at now kind of falling in line with those projections?
I think so. They are within our hospital. I don't know about outside of the hospital in the community, and I know the public health have been doing really a great job just reaching to the healthcare workers in the community, and now the senior citizens, those who are at 75 years and older, and it's really I'm very impressed that our Manamcos are coming and getting the vaccine. And so that shows their courage, their commitment, and the confidence they have with this vaccine. So
yeah, I've noticed that, and I'm sure you know it as well. As far as us older folks, the stubbornness as far as medical attention. So, what do you think it is that we're seeing the numbers of the Manamco come out when maybe normally they say, "Oh, never mind, I don't need that," or why do you think they have this confidence?
Well, again, they want to protect themselves. They don't want to get the COVID, and they also want to protect their families so that it doesn't get transmitted to the others and their grandchildren and their children. And so, and that's good that they're coming out and their courage. And I really am impressed. And really, I'm excited and I'm glad that they're coming out.
Yeah, and that's what we need here. We need everybody that can get vaccinated just so we can really knock this out of the park.
Right, as much as we can. Right.
Yeah, absolutely.
Lillian, I wanted to follow up on some of Andy's questions, going back to the Bamlani VMOB. The 25 doses that we got, or 50, and then 25 went to GMH, 25 went to GRMC. So you used all 25?
No, we haven't. Okay. We've transfused like about 13 of those units to 13 individuals. And, as much as the doctors in the emergency room, when these individuals come in, when they do their assessment, unfortunately, the patients the individuals that come into the emergency room, they're sick, they're quite sick that they don't then meet the criteria. They need to be hospitalized. And so therefore they don't, qualify for the antibodies. And so we're trying, and I don't know if the PAG, the Physician Advisory Group, if they discussed this, that maybe out in the community clinics, because they see those individuals who are not too sick to need the hospital. So maybe that will be the venue for the administration of the Bamlani VMOB in those settings.
Mm-hmm. What about the convalescent plasma? Same sort of situation?
Yes, we've administered I believe, if not 12 units, but 8 individuals. Some of the individuals received 2 units, not just one. Mm-hmm. So we've given about gosh, I can't remember now how many, 11 or 12 units have been administered.
Regeneron did you guys just receive that? I know we've talked about it in the past, but
We received the Regeneron a couple of weeks ago, but the doctors needed to go through the protocols first, review them, and make sure that, they're okay with it. And so they've approved now the protocols.
and so you plan on administering that when? Or
When the doctor, it's all of the doctors, depending on the doctor's prescription of it, ordering of it.
oh,
Yes.
but it's here on Guam. It's here on
It
Guam.
is.
Okay.
It's have it in our facility, in our pharmacy.
Is this through HHS also?
Yes, it is through HHS.
And so how much Regeneron did we get?
I don't have the number right now, but I can certainly get that to you.
The Decadron, is that new? Or is that just something you've
No.
always had?
The doctors have used that in conjunction with the remdesivir. And so that's the treatment modality when they're in their acute stage of this COVID. So the doctors use it in combination with the remdesivir.
Okay. And so going back to the Bimab, whatever. We have to wait till all of that is used before we ask for more from HHS?
Well, it seems like depending on because we submit our data through HHS, and depending on our data and the utilization of it, then they replenish the shipment.
I'm sure you've heard of the new strain that's out there. Do you know if these treatments, or is it just even too early to say whether they would be effective?
Right. They don't have a whole lot of data, but from what I gather in the news, that the vaccine, the companies, Pfizer and Moderna, they think that it will still be effective with this variant. But again, they're still gathering the data, and they're doing some testing on it too.
Well, we have seen the hospitalizations really go down. What's the census today?
Today it is 12. We have 12 individuals with the COVID infection, and of the 12, 3 of them are requiring ICU level of care. Of the 3, 2 are on the ventilator support.
Yeah, and I know you spoke with Peter earlier this week. You're making all kinds of renovations over there at the SNU, right?
Yes.
Okay.
We're still working with the contractor in terms of the design.
Really, your final message and to the people of Guam. It's been a rough year for all of us, but most especially over at the Guam Memorial Hospital. There were times where I think I was scared because
we all were. We all were because this is all totally new, and so. Yes,
but just the fact that the